recognize their continuing connection to land, water, and community. We honor with gratitude the land itself and the Coast Salish people who are still here today. We recognize the systemic oppression of Indigenous people, enslaved Africans, and other historically exploited people, which has led to the disproportionality in representation and disparities in health of these communities we serve. We are the Pacific Hospital PDA, your host for today, and our mission is championing health equity to support and provide funding for the best possible healthcare in the Puget Sound region to eliminate health disparities, for access to health resources, and improve health outcomes. So some housekeeping before we start. You can introduce yourself in the chat with your name, pronouns, role, organization, where you are, and what brings you to and inspires you in the work. Make sure that you mute your mics. And said here stays here, but what's learned here leaves here. Take breaks as you see fit, and be aware of how much you are or are not speaking and participating. As the PHPDA staff, I'm Mallory Fitzgerald, the Grants and Program Specialist, along with myself and Christina Bernard, our Finance and Program Director. The two of us will be helping facilitate some of the breakout rooms. Next slide, please. And our other facilitators with us today are also two former health equity scholars of PHPDA, Gift Nwane and Lena Trong. And I will let Amanda Knight-Shee introduce herself, our presenter for today.
Hi, everyone. Good morning. My name is Amanda. I use she, her pronouns. I'm currently the Research and Evaluation Manager at the Tubman Center for Health and Freedom, one of PHPDA's major grantees. I am also a former PHPDA Health Equity Scholar like Gift and Lena, and I'm so excited to be here again. Previously, we had sessions with Gift on logic models, as well as I was able to do an evaluation session. Like Mallory said, while this information all builds on each other, it was not necessary to see those before, but you are welcome to visit them in your pre-materials after. So let's get going. Our agenda today, we're going to briefly go over the pre-video slides, and then we're really going to go into data collection, and the majority of our time is actually going to be spent in breakout rooms. The goal is that you walk out using that worksheet with a data collection plan in hand that you can execute back at your organization, that can synergize all your different goals that you have, whether it's to report, to learn about your program, or any other information you want to learn through research, data, and evaluation. As for questions, we'll have a specific Q&A time at the end, but feel free to add questions in the chat throughout, and I will either address them on that slide, or I will point to the other slides that we will have the opportunity to talk through those questions. So the learning goals for today: we want to learn how to collect data that is community-driven and culturally appropriate. We want to discuss the connection between anti-racism, equity, and data collection. And we want to design a data collection strategy for a program at your organization. We're all about doing the action. So walking out of here will be really, really important to actually have something you can use. So really quick, we'll go through the pre-slides. So we talked a little bit about what is evaluation and what is the purpose of data collection. So if folks can actually put in the chat, what do you think of when you think of evaluation, or what do you think of when you think of data collection? Folks are also welcome to unmute. A way to, thank you, Hannah. Yeah, definitely. A way to get concrete information to share with outside agencies. Thank you all. Gathering information to inform future and better interventions. One use of data and evaluation collections as a means of assessing the impact of work being done, getting feedback from program participants on effectiveness, and help us understand if we're fulfilling the mission of the org, how well we executed the plan or program, and then communicate the impact of our work. Thank you all. That is all. Oh, I'm sorry, my mouse is sliding. That is all the goals of data and evaluation. And those can all be synergized. That's what we're going to be talking about today, because often, even in my own work, sometimes it can seem like balancing all these goals can be difficult or incongruent. But our goal today is to walk out so you can hit all of these goals at once, both being accountable to community and the folks you are working with, as well as doing internal learning, making sure you're following your mission, vision, and executing your strategic plan, as well as also sharing your learnings with outside agencies, policymakers, funders. And so we'll be talking a lot more about that today. So some of the main drivers for evaluation and data collection, as you all said, improving those outcomes, sustainability, assessing the effectiveness, and being accountable and helping drive informed decisions, which you all covered in the chat. So again, we can synergize these goals. They do not need to be disconnected. And it's also very important that we also are planning in the beginning, such as in the session, so that when it comes time to collect data, it's much more streamlined and it aligns all these goals. So we're going to do a quick framing exercise for folks. There's in your pre-session email a worksheet for the breakout rooms, and we'll go ahead and get that set up right now for folks who did not have the opportunity to watch the pre-slides. So on that document, go ahead and download a copy and add a program your organization provides, and go ahead and share in the chat what you will be looking at today, as well as go ahead and write that program down on your worksheet. Great question. So in the pre-session email for the session, there were some attached Word documents as well as PowerPoints. And one of them is called the worksheet for this session. And it'll be a Word document with a space for program name, as well as a few guiding questions that we'll work through in the breakout rooms.
I've also just put it in the chat.
So do folks have a few programs that you are hoping to look at today? So we have the Elizabeth Gregory Home, the Health Navigation Program, and one of the goals is to better understand the needs of guests to improve the events and programs we offer. Thank you. So for folks, just go ahead and set up that sheet and we will build on that in the breakout rooms. So one of the biggest important things for research and evaluation is making sure that you're setting your goals for data collection and evaluation in relation to your program and in relation to your overall org goals, to make sure you're not doing research for research's sake. As we think of the history of research, it's really important to be intentional on what the burden is on community members, as well as thinking of the burden you're asking of frontline staff and various members of your organization. And so no research for research's sake. Thank you for sharing the Young Woman Empowered. These are awesome programs that we can talk about more deeply in the breakout rooms and really set up that data collection plan. So the flow for the breakout rooms later today, just to start thinking about which one you'd be most interested in as we talk through each of these types of data collection. There's going to be a room focusing on interviews and another room focusing on focus groups. So these are those qualitative sources. There's also going to be a room focusing on observation and admin data, then surveys and assessments with a focus on electronic health records for agencies that use EHRs. So with the observation room, one key caveat is that it's not what you think of the traditional field observation, someone taking a notebook and going and writing notes and watching something happen. We're talking more about how do you debrief with your frontline workers and use that as a form of understanding what's going on with those that you're working with in community. So we'll talk a little bit more about each of these topics. So again, data is just a really great tool to support our health equity work. It's, again, no research for research sake. When we are structuring data collection, it's really important that we align our goals in the start and really emphasize how do we lessen the burden on ourselves and our communities. We also can creatively think of those sources of data. Like I mentioned before, there's beautiful things like admin records, which may already be accessible or in your organization that you can use for your evaluation and reporting. Also, we'll lay out some data collection strategies today. It's really important to strategize to fit the pieces together like a puzzle where you can use both qualitative and quantitative data. And most importantly, is that data stewardship and community protection, thinking about where we store our data, how we're asking questions, and again, what's the burden to the people we're working with. So again, equity and anti-racism is central to all research and evaluation. We must understand the histories of research and how it's been done onto our communities rather than with and alongside our communities. It's really important to think of that every step of the way to make sure we don't reproduce harmful practices. Also thinking about ethics and equity, how are we sharing our evaluation findings back with our communities? Are we having an ongoing conversation, a discussion, reflection? Are our participants really understanding what they're consenting to? For example, sometimes it can be confusing if folks think they have to fill out the survey to receive the services, as opposed to something being more voluntary and about their consent. Also, we're tying it back to structural drivers of inequity. Are we making sure that there's things like childcare, transportation in our focus groups, food, stipends? Also thinking of who is the burden of data collection on when we're designing these tools. Like if we're making a really, really long survey that takes hours of time, that's putting a lot of burden on our community members and the person, the staff member who maybe has to go through the data. And again, are we using all that data? Do we need to collect it? Also thinking through things like accessibility. Are we choosing methods that uplift voices? For example, thinking of if we're doing in person or on Zoom, thinking about if we're doing like a paper handout, the size of the font. Are we doing something that's a survey online for folks? Do they need computer access? Do they need internet access? And again, we're thinking also who is included and who is not and why not? Is it because, again, they maybe live in a rural area and are not able to come to your focus group? Is it because language capabilities that they have that may be other than English? And also, are we engaging with culturally responsive methods? Is it attuned just to our community members and their cultures and the richness that exists within our communities? So these are all really important to think of at the very start of when you're planning and throughout the process. So just an overview of the sources of data and data collection methods we'll go into. I'll talk a bit about primary or secondary data, and then these are the deep dives we'll do, which will go with the breakout rooms. So those quantitative data sources are surveys, admin data, assessments, and then we'll talk through qualitative sources of interviews, focus groups, and observation. And then we'll talk a little bit about something called mixed methods at the end, which is you can use a mixture of these two to help inform each other. So thinking along the community engagement continuum, this is a very common graphic about community engagement and research. So you can go anywhere from just informing community members all the way to sharing leadership. And when we really think about equity and continuous relationship building, that shared leadership is really, really important. Having conversations about, oh, we found this trend maybe during our survey, and having an actual conversation with community members to see what do they interpret that as? What could that be attributed to? Can be really powerful for relationship building and to better understand what the actual research is telling you and what the data is telling you. And then lastly, as we finish out our pre-session slides, thinking about reducing the burden, I'll emphasize this repeatedly throughout this presentation as a theme, it's important to think through what data is already available to us, because we often have so much more than we think. Things even like a sign-in sheet at an event, that could be a source of data that we're already collecting for other purposes. And also really thinking again, what do we need to know about the program? What do we want to know about the program? And how can we really get creative about data collection? There's a lot of like arts-based approaches, things that integrate like the body. There's all different ways to make research really fun for those who are participating. And when should we be planning what we collect? That's this session, as well as a continuation of sessions like this, where you get to really think through your planning process and work with your team throughout and your community members. And again, how do we relate this to our funders and our deliverables, creating a pathway to sustainability? As we know, a lot of us are braided funded organizations. So how do we really make it a sustainable pathway for us? And again, we're not doing any research for research's sake. We're going back to those original goals and synergizing them. So we will go into our main session today. And thank you all for sharing your amazing programs in the chat. We're so excited to just learn more about each other and community in our breakout rooms, as well as like build strategies together and really have that thought partnership. So we're going to dive again, starting with those quantitative data sources, and then we'll dive to qualitative. And again, at any point, if you have any questions, go ahead and add them in the chat, and I'll either answer them directly from the chat, or I will point us to another slide where we'll have the opportunity to talk through those questions. So the three types of quantitative data we're focusing on today, there's a broad range of quant, but these will be most relevant to some of the work we're all doing in community. The types we're going to talk about are surveys, which are generally defined as a structured questionnaires that can be a mixture of open or closed-ended questions that focus on understanding attitudes, behaviors, or sociodemographic information. I'm sure everyone in this room has filled out a survey at some point in their life, whether it's patient satisfaction or some kind of research survey. There's just a bunch of different things you can do with surveys as a tool. We'll also talk through administrative data. That's existing records and databases. That's things such as publicly available sources like the census. Washington State, the Department of Health collects a lot of open data sources as well, or we'll focus in today actually on organizational administrative data. That's data that you're collecting to do your day-to-day operations and your day-to-day programs. And there's a lot of information already there that you can utilize for evaluation. And then the last source of quantitative data we'll talk about is assessments, where we're really going to talk about specific attributes or outcomes such as like health status or program impact. These are things that you might see, let's say, for your annual visit with your primary care doctor. Some of the PHQ-9 is a common depression screening that you might get. It's like a multi item assessment, and those are gold standard, which have been tested over clinical trials over time. So in the chat, which of these data sources does your org already have access to? So some of your orgs might already have access to all three of these, or something for those who use HRs, you already have assessments. What are some things that folks already have that they can use? This is great. So folks have all these quantitative data sources, things like medical records, things like surveys, things like check-in data. These are all sources of data. And what's going to be great about today, we can talk through how do you either add on to this, or how do you ask a different evaluation question and look at your existing data? So once you have data collection, even if your original research question was one thing, you may have the opportunity to do a kind of secondary analysis of the information you already have to answer another question that you maybe have about, are you fulfilling the mission? Or maybe a funder is asking about something, or maybe you want to share something with a policymaker. So everyone already has such richness in data, and so we can talk through how do you reuse that and keep using it. So first we'll talk about quantitative data surveys. So I'll go through some of the benefits and challenges, just general ones for each of them, just as you think through which sources you want to continue to lean into or continue or further build out. So surveys can be really great because they can be open-ended, where you can have that, kind of short answer response, free response, or you can also have close-ended multiple choice or things like Likert scale. Do you agree, strongly agree, disagree? And the nice thing about surveys is they can be very cheaply delivered through online forms, things like Google Forms or things like RedCap that are all free to use, or you can also do subscription services that have a little more user design customer service like Qualtrics. Also, you can do them by phone if you have a staff member who's doing consistent outreach that you can ask certain questions, or you can print them. What's important is these different levels of surveying do have different levels of protections. Like some software is HIPAA compliant, while others, like Google Forms, might not be. And so it's important to think, what am I asking? Where am I storing it? And what happens in the case that there's a data breach? Like, how are we making sure we're protecting against that? So what can be really, really beneficial about surveys is you can get a lot of information from a large number of people, and you can also really, really make it in depth or really brief, like a 3-question feedback survey. In addition, some of the challenges, however, are there might be response bias. For example, something called non-response bias. That's when certain people don't respond, thinking about why they're not responding. So the folks who are responding, you might have certain community members who are more eager to talk or give feedback. And then also you could get a breadth of questions, but sometimes you sacrifice depth, which you get in things like interviews or other qualitative forms of data. But surveys are a really, really accessible tool and really tailored to what your program needs can be. So surveys can look all types of way. This is one of my teammate, Tiara. She designed this for a youth participate action course we did. So we were working with young people, like 6th grade to 11th grade. And so we took what we might see, a Google Form survey, and we translated that into images, to art, to be engaging. So surveys can be really customizable. And throughout this, I'll talk about how we use like color, art, and different ways of creative expression to make research a little bit more fun for those who are participating. And so we are really, really focused on mental wellness throughout this participate action course, as well as like policy learning. And so we took a Likert scale, which is the strongly disagree to agree, and made it into pictures, actually, as you see those smiley faces at the top. And thinking of the youth audience, that was a really effective way to keep folks engaged. Also, you can see the mixture of open-ended questions and closed-ended. At the top, those are those closed-ended ones, and the bottom are more open-ended ones where they're short, free response. And what was really great about this is kids were eager to fill it out. It was fun and engaging. And we also collected it after each session we had. And so we were able to get multiple data points and track change over time, even in a short internship program. So that's just an example of what surveys can really support you with. They can give you immediate feedback. So we were able to tailor our next lesson plans around our group. And also we were able to track changes over time. So we were able to take a survey at baseline and then show the change after our program at the end, which is really beneficial because while often for impact assessments, you need years of data, you can show changes over time with even short programs using surveys. So another source of quantitative data is administrative data. And it comes from federal, state, local government programs. King County collects a lot of data. The state collects a lot of data, as well as each of our organizations collects data for program operations. So what's really great is you can get historical data that your org has been collecting over time, and you can utilize something you already have, doing a secondary review. And it's extremely cost effective because you don't have to spend hours designing a tool or delivering a tool or looking at the feedback or things like printing. And the issue though, sometimes because you're collecting it for another goal is you might not have complete data or might not be fully relevant. And you do want to make sure that when you're using participant data, that they did consent for their data to be used for other purposes. So that's back to the informed consent process and designing at the front. So even when you think of administrative data, just clarifying with folks that you might use it for something like evaluation later on can help you have more options when you do your evaluation. So examples of some popular administrative data sources, and we'll talk about, assessments in a little bit too, but folks said in the chat, review of medical records, like the electronic health records. You can look at appointment scheduling systems or visit logs like sign-in sheets. Sometimes you can look at enrollment program completion records, things like inventory even to show like what was most popular in your program. You can also look at quality metrics, and then there's broader government collected data such as census data or geographic information. And you can use a mixture of these to help paint a picture of what you're trying to evaluate. And quantitative data with assessments is the last type of quant data I'll talk about today. I really want to share how this differentiates from surveys, because these are often standardized tools with specific scoring criteria, and they're sometimes offered in controlled environments or administered, such as by like a physician. They can include tasks, questions, performance-based evaluations, like someone talking about activities of daily living. And they do offer very objective, quantifiable data, again, because you're basing it off that scoring, gold standard scoring. However, sometimes these may not capture the full context of an individual's situation. And also, historically, design of certain tools and standard clinic scales have excluded medically marginalized communities. If you think of the history of clinical trials and who's been a part of them and who's been part of testing gold standards. Sometimes they might not capture a full person's experience or symptom presentation. So it's really important to think of the tool you're using and also sometimes match it with some qualitative data about someone's experience. So again, a few of these common examples are like health risk assessments, reading level tests, job performance evaluations, community health needs assessments, clinic assessments. So these are all various types. And assessments can feel like surveys. Sometimes they're very similar, but the key differences are sometimes these have gold metric scoring scales. So now, qualitative data, we're going to talk about these three different types: interviews, focus groups, and observation. And then I'll talk a little bit about what a saturation point is. So interviews are where you gain in-depth understanding participants' experiences, opinions, or perspectives. Those are often one-on-one and they're with a key group of folks called key informants who help to show a trend. Focus groups can be about group dynamics and collective views on topics. You really have the interaction between people, which brings a richness to the information you're learning. In addition, there's observation. And like I said in the beginning, we're not talking about going and taking your notebook, and going to the market and observing folks. More so debriefing with people in the field who are already providing services, such as caseworkers, social workers, community health workers, and actually doing debrief with them or having them take notes in a way that can help you better understand how you're delivering your program. And in general, the saturation point is when data does not yield new or relevant information or insights about what you're trying to learn or your goals. And for each of these, for interviews and focus groups, especially, they can be different. For interviews in general, it's around 8 to 12 interviews. For focus groups, there's some debate in the literature about what a rate is, but in general, it's when you're not learning anything new anymore from additional groups. So in the chat, which of these data sources does your org already have access to? Yeah, these are great. We're seeing some interviews, some focus groups, and a lot of observation access, which is really wonderful because with support structuring the observation a bit, you can help to answer a lot of those questions and hit a lot of those goals you all mentioned at the beginning in the chat. So we'll dive into interviews, focus groups, and observations now, and then we'll have the opportunity to go even deeper in the breakout rooms. So with interviews, the design can be, very structured. You have your list of questions, or you can have them semi-structured where you have some questions, but you also allow some flow, or you can have unstructured where you have your general goals, what you're going into, and let the conversation flow very naturally. And again, that 8 to 12 is considered the gold standard qualitative saturation point currently, where after 12 interviews, you might not get new information. And so what's really beneficial is you do get, with a lot of qualitative data, really detailed information and the option to be really flexible in how you explore topics. Like you can ask follow-up questions, whereas, on a survey, because it's already set, you're not going to be able to ask the participant a follow-up unless you do a follow-up interview or some kind of follow-up specific to them. So this allows real-time follow-up. And also, having a one-on-one setting can be really, really great for confidentiality and trusted sharing. A lot of times people will really open up as long as you have the correct protections in place and make them feel comfortable and let them know that you will protect their information and data and that they can share openly. One of the challenges is it can be time consuming, and there is always the potential for interview bias. We all have our own positionality as people, and that can shade how we're asking follow-ups or how we're framing the question or how we're interpreting what's going on during the interview. So with interview, this is a general list of steps. So you can prep an interview with an interview guide with a list of questions, tying those back to your general goals. And then also just ensuring you have a consent and privacy statement at the beginning. For example, if you plan on doing an audio recording or if you're doing it on Zoom and recording, make sure that they're consenting for the use. And often after you transcribe the original audio, you can let them know you will delete it. So just going through that and answering any questions about the process is really, really important in the beginning of any interview. And then during the interview itself, you can use things like active listening and again, those probe responses as needed to be like, could you tell me more about that? Or you mentioned this item, could you explain why? So asking that you get that depth of information. And then during the analysis phase, you take the audio recording, transcribe it into like a Word document, and then you can go through cleaning the interviews basically as you listen to the audio and then you look through your transcription to see if there was any transcription errors. There's also software that does that for you, tools like Otter, but Zoom also does audio transcription and a printed transcription for folks. And then lastly, you do thematic analysis, and there's different tools to do that. You can do it in Word, or you can do it in places like Deduce or Atlas TI, these different qualitative softwares. So this is an example of a really brief interview guide. This was a semi-structured, really open one. The probe follow-up questions are included in this, but this was work we recently did where we were hoping to learn more about provider experiences in healthcare, and a little bit more about their retention and recruitment environment. And so you can see that these questions answer our questions about recruitment or retention, but also give the provider an opportunity to be creative and really be imaginative of what they would like to see in healthcare. And so interviews, again, can be a really great place for imagination and learning more about someone's experience. So we'll talk a little bit more about focus groups now. So the design of focus groups, so you have facilitators, sometimes co-facilitators who are working with the groups, and participants, you generally have about 6 to 12 folks who are representative of community or the program you're seeking to evaluate. And there's a certain homogeneous factor about focus groups that you want to center to make sure that you can actually capture a shared experience. For example, if your program is working with youth and families, perhaps you want to have an all youth group or a middle school group, then a high school group, and then a parental group. And so the reason for that is you can get more in depth because people may have different experiences given their positionality. So you want some kind of shared positionality. Also, with this, you'll need a set of topics and questions to be covered to explore more as needed, similar to interviews where you want to prep some kind of focus group guide. And one of the great benefits is you can get such a wide range of perspectives from different people, from different experiences. And also, you often want to have interaction between participants. So, participant A might say something that participant B is builds off of, or you might have participant A say something participant B may disagree, right? That adds some richness to the conversation. And it can provide those natural compare contrast opportunities. And yes, the slides will be sent out after as well as the recording. So I know there's a lot of information, and so these will always be available after. Thank you for that question. Um, and though some challenges, though, again, there might be group dynamics, as we know in any situation. There's maybe some folks who are more vocal, some folks who are more hesitant to share their experience. So really managing those group dynamics as facilitator and setting ground rules and expectations at the beginning can support with that, but it is a challenge with focus groups. And also capturing group dynamics may be difficult in addition to responses. This is where it's helpful to have some more co-facilitators and maybe assign 1 or 2 people to focus more on questions and another person to document the different interactions and responses. However, being aware, depending on how many facilitators you have, it may change the environment in the room and folks' level of comfort with who is facilitating. So with the focus group, these are some of the steps, just like preparing an interview, that you can walk through. There's again the recruitment of participants and setting up logistics. For example, if you're doing something in person, you're going to need a bigger space so folks are comfortable. You're also going to need that discussion guide and then figuring out a way to record the conversation. So the beautiful thing about Zoom is you can hit record no matter how many people are in the room. However, in person, you may have to pass an audio device, like something on your phone around, so folks can speak into it so you can record the conversation. Really important too to think through with focus groups is how people are going to get there, transportation, if you're feeding folks, if you're providing stipends for their time, also if you're providing childcare for folks or supported child play. These are all really important aspects. Also, again, with facilitating, it's just very important to manage the group dynamics and to set those group norms and expectations in the beginning. Also to encourage participation from all focus groups. So if, for example, if you notice someone not speaking at all, you really want to maybe ask them a question or ask them how they feel about this question to include them in the conversation. And then again, similar to interviews, you can ask follow-ups and then provide comparison, contrast, or similarities. So you can mention, oh, well, this person said this while I'm noticing this. What do you, this person see, think? And then lastly, summator interviews, you will transcribe and clean the focus group discussions. That's why it's important to have that recording to make sure you're actually documenting what folks are saying. And then lastly, again, the thematic analysis where you code through the transcripts and then you look for themes that pop up. And themes are kind of like trends that you see in the data. So this is an example of a focus group guide. I'm using a lot of Tubman Health examples. This is where I work. So this we were hoping to understand a bit more about these different elements. As you can see, the difference with the interview guide is it was really tailored towards more one topic to two topics, whereas this goes through a bunch of different elements of a healthcare model. So we were asking folks about what do they want for clinical services? Like a lot of these are implementation questions. There was things we wanted to know about provider engagement, and then also systems navigation and accessibility. So there's a lot of rich discussion that happened in our focus groups with these wide range of questions. So with observation, so again, we're going to focus on a specific type of observation relevant to our community work. And so this is where we talk about the researcher being a participant or non-participant. And so we're going to talk about participant more based researchers. This is where you can actually work, if you wanted, with a community member to support them in helping you with the field observation, or more importantly, in our cases, staff members who are doing the frontline work, who are working in community, can do this kind of observation because they're probably already doing it in their day-to-day work. What you want to do is define what you're looking for and develop a guide to maybe add to their home visits. For example, if you have a social worker already doing home visits, you can add a few other questions internally to have them to track, and then you can get the information feedback from the social worker or the frontline worker to have as your observation data. And this insights into what behaviors and interactions and needs are in a natural setting. So you get to see community members, whether, example, that home visit, just in their homes, like what's going on, what do they need support with? And then it also provides a lot of contextual factors that can show you, oh, maybe, for example, one program is not getting used as much because there's a bus line that's down. So you might not have figured that out from a survey, but by doing observation through your frontline staff, you're able to actually see some of the context. And again, I just think the big caution with this is just make sure you're not making people into subjects and how you're observing. And of course, there's ethical considerations like informed consent and privacy. So even when you're doing observation, for example, again, that let's say that social worker who's doing home visits, you want them to talk to the person and be like, hey, by the way, we might add additional questions, or I might be noting different factors that we might use to help evaluate this program later on. Is that okay with you? And it does often take a lot of time and data points to capture comprehensive data, but if you're folding in or observation into programmatic things you're already doing, it can be a value add. And then also there is something called observer bias. We all can kind of act different when we know we're being watched. And so again, that's what the general, if you have the researcher observing being as a secondary body versus in our case, if you have someone doing debriefs from frontline work, people will feel much more comfortable because they also already have a relationship with that person. So just in general, to recap, a lot of information will be sent out afterwards and we'll dive more into it and focus on our breakout rooms. But just a few of those quant data sources are surveys, admin data and assessments. And for qualitative data sources, interviews, focus groups, observations. And you can use a mixture of these to support your work. So really, really briefly, I'll talk about mixed methods approaches. So mixed methods is when you use one of these sources, like a quantitative data source, to then the findings of that to inform your qualitative data source, or when you use a qualitative data source to inform your quantitative, like design of your quantitative data, or you can use them both and then compare or relate their information. And what's really great about this is sometimes it can add to your existing data collection that you have. For example, the explanatory sequential design, that's when you could have something like a survey, like a brief 6-item survey. And then from that, let's say you're identifying this really, really big trend and you're not really sure what's causing it. And so with that, you would follow up with perhaps some interviews with a few participants in your program to identify why you're seeing that trend and how to help better address whatever programmatic need it is and better support community. And so that's where just because you select one, you don't have to stick with one, and you're able to use a mixture to support your work. And then again, I just want to come back to emphasizing the data stewardship and community protections overall. Where your data is being stored is really, really important when you think of what types of data. Also, who has access to it, and things like electronic health records. You can have different people on reader view, you can have some folks on full access, and you can also track who's looking at what. And so that's really, really important for protections for participants and people's data. Also thinking about things like how you're storing sensitive information, if you're collecting social security numbers for some reason or other information that's really, really sensitive, or even social demographic information, you want to make sure that you are really protecting it and having the right considerations about privacy. Also, when you're sharing out, making sure that you're removing identifiers so that people can't be tracked back based off of how much information you're giving. For example, if you're trying to contextualize even a share out for an interview, if I were the interviewee, you wouldn't want to say a person working at this organization who lives at this zip code, who is this age. That might be really, really identifying. So thinking about making sure you're removing identifiers. So it's truly de-identified data. Um, and then again, people's data, people's choices, just putting yourself into everyone's shoes that you're talking with and doing research with and evaluation with. Like imagine if it was your data, like we all share data all day long. Like how would you want your data protected and handled? And most importantly, how are participants and community members included in both the data collection and research processes? Are they there at the start? Are they there when you're interpreting the data? How can you continue to build a partnership with your community members while balancing your internal capacity and ability to also do things like compensate them for their time? So, really quick, last thing before we jump over to breakout rooms, how would you want your data handled? Yes, definitely. Intentionally with security. That's huge because if we think about, in the news all the time, there's all these data breaches and all these people's information. So even thinking of like where you're storing it, what servers you're on, who has passwords, how often are you refreshing your passwords? These are all really important in general, and especially when you have communities data. And yeah, with the aggregate and anonymous set, that's great too. Yeah, that's very important because again, with the de-identifying, when you're doing themes and when you're taking, people transcribing people's interviews, even afterwards, you want to remove the identifiers in that as part of the cleaning process to make sure that you, again, are protecting people, have aggregated data, and they have their protections in place. Thank you all. So with that, we will be transitioning to our breakout rooms. So go ahead and pull up that worksheet that you had with the program in mind. And in each of the breakout rooms, one of our facilitators will take you as well as a few other folks through each of the questions. So you can walk out of here with the data collection plan in place. So we, at the end, will come back to this main room at 11:20 for any overall questions, considerations, thoughts. But we'll spend the next about 25 minutes in these breakout rooms. After like 15 or so minutes, you are welcome to switch rooms, thinking about those mixed methods approaches. Your worksheets have a both quantitative and qualitative section. And so if you, for example, wanted to start in surveys and then wanted to go to interviews, we'll let you know around when it's halfway. So any last questions before we go to breakout rooms? Great. We will go ahead and get those breakout rooms open now and go ahead and self-select into them. And if you're having any trouble getting into a breakout room, we can help you get into them.
You should see a button at the bottom for join breakout room, in case nobody noticed that pop up.
So nice to see everyone. Um, we time ran by so fast, so we can always continue the conversations. I'll provide like our contact information at the end too. But for folks, do any questions or any questions coming up? Pull up the slides again. I will leave the slides down so we can just see each other and ask questions. Okay. Well, if we don't have any questions, you can always follow up on email, like I know, thank you, Gift and Lena and Mallory and Christina and Brenda. It was really great working with everyone. And yeah, go ahead if you have any follow-up questions. We'll drop our email. I think we're just all bit research nerds too, so it's always great to connect with others to share a little bit about what we're passionate about. And also, like, part of these sessions is also about building community. So hopefully you also make connections in your breakout rooms with other folks doing the work. Because one thing we were able to talk about in our breakout room was great is relationship building. You can even co-host focus groups or interviews together. And if you have the correct like consent procedures in place with your participants, like some kind of data sharing agreements could be brokered where, you know, you're at the end of the day, a lot of us are serving a lot of the same community members. And so if you're able to connect with folks in that way, like that again lessens your research burden and reduces that research for research sake. And instead you're able to just build that relationship as an org, maybe even create referrals to each other, and do your research and evaluation together, which at the end of the day is just more sustainable and helps us build an ecosystem of community orgs and folks working to support community. So thank you all.
I have kind of a specific question that I was asking in the other group, that if others don't have. I was curious if there is an online tool to do thematic analysis that you all like or have used.
Yeah, that's alignment's perfect. I can send out in our post session, there's a really great open source textbook from like a social work textbook about how to do thematic analysis and go through the whole process. And that is a really great resource. I think Selena and Gift, I probably learned similar ways when we were in school of like how to do thematic analysis. And then you can sometimes find like some example ones to start coding through, but that textbook is pretty comprehensive. And so I can link that and it's completely free and just online. And then you can use Word to code, which is really nice because we're all about free to low cost resources.
Yeah, and there are some good softwares as well. Like, you can use MaxQDI and also Tableau and Deduce. So they have some really good features that you can use.
Thank
Tableau,
you.
I know Tableau has a kind of a subscription, but if you use Tableau Public, that's free, so you can use that.
And I think Max QDI and Atlas TI actually have like an AI feature, which like, AI, but it does do some AI coding. So if that's of interest, like you all have to like probably scan through to see like, oh, did it really align with what I was hearing in the groups? But it is like a pretty good starter point. Well, thank you all for your time. Yeah, our emails are in the chat. And as always, like always happy to have continued discussions with folks just because we're all at community orgs and working on aligned goals, working towards health equity. So happy to have a follow-up conversation with anyone. And otherwise, I hope you all enjoy your weeks and we'll have lots of resources afterwards coming your way.
Thank you so much. Appreciate the initiative.
Yeah.
It was fun.
Thank you.
Thank
Yeah.
you.
For the
all
invitation.
joining us.
Okay. Bye.